Hi, Jenny.
I just wanted to really quick check the medications I'm about to get.
Okay, perfect.
So I have vancomycin IV 200 milligrams for Mr. Johnson.
Okay.
Paul Johnson, and his date of birth is 2/17/53.
Okay.
And then I also have amoxicillin for Thomas Smith, and his birthday is 4/20/50.
Okay, great.
Mr. Johnson is actually allergic to penicillin.
Okay.
And they're both IV piggyback.
Okay. And does Mr. Smith have any allergies?
No, he doesn't.
Okay. Okay. And I've seen you give IV piggybacks several times before. I think you do a great job with it. You seem comfortable. Are you comfortable giving these medications by yourself?
Oh, yeah.
Okay.
I've done so many times.
Okay. So I have another student to go help. So as long as you're comfortable and we know you're giving amoxicillin to Mr. Smith and vancomycin to Mr. Johnson. Okay.
Yeah.
All right. Well, I'm going to leave you to it, and I'm going to go help this other student.
Thank you. Thank you so much.
Oh my gosh, you haven't hung that yet?
No.
Radiology's on their way up to do a chest x-ray of Mr. Johnson right now, so we need to get that amoxicillin in. We're late. So please go do that right now. But don't fiddle, you just need to go ahead and do it. Yes,
Just amoxicillin?
yes, just for Mr. Johnson, he needs it right now.
Hi, Mr. Johnson.
Hi.
How are you?
I'm okay.
I'm gonna be giving you some amoxicillin. They're coming to get you to get an x-ray, okay?
Okay.
Just hang this really quick. Let's see. Alrighty, I'm gonna go real quick, and when you get back from x-ray, I'll come check on you, okay?
Alright. Someone help in here! I need help in this room. This patient's not breathing. Help in the room.
Sarah?
Yeah, hi.
Hey, you won't believe it. I can't believe what I did. I'm kind of freaking out right now.
Uh-oh, what's going on?
Well, I'm at clinical, and I had just talked to Dr. Lambert, and I had made all my medications. I had told her the 2 medications that I was gonna give, and then I started to go do it, and Karen, you know Karen?
Yeah, the nurse?
Yeah, the staff nurse, she says, go give this medicine to him, and she pointed to the one medication that I knew I wasn't supposed to give him, and oh my gosh, I gave him the wrong medicine. What am I gonna do?
Oh,
I don't know what to do. I honestly, I felt like I knew it, but I questioned her, and she said she was so adamant about it being the right medication.
no.
She,
Oh, no. How's the patient?
that's the worst part. He had an allergic reaction, and they took him to the ICU. I don't even know how he's gonna react.
Oh, no. Did you talk to your instructor?
Oh yeah, I'm just probably not even gonna be able to graduate. I don't know. I'm so nervous. I just knew what my gut was telling me, and I should have just got the doctor.
Oh, I know. That nurse, she was pushy, huh?
Yeah, I just was intimidated, and I made a mistake, and I'm probably gonna lose all of my schooling.
Oh, I'm so sorry. Maybe you should talk to your instructor some more.
Okay, yeah. Oh gosh, you think I'm gonna get kicked out?
I don't know.
I don't like that nurse. I mean, I don't want to blame her, but really, she made me feel so scared and nervous.
I know. Oh, I'm so sorry.
Yeah, can I come over?
Yes.
Okay.
I'm so sorry.
Okay,
I
okay,
would go talk to your instructor.
okay. I will.
Okay.
Alright, thanks.
Bye.
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 Oh my gosh, Nancy, it happened. It happened. I can't believe this. This is something I've always worried about, teaching clinicals, and today this is horrible. I don't know.
What happened? You're really upset. Are you at clinical today?
Yeah, I had to come take a break. So you know Jenny Thompson, do you know her? She's one of the senior students. Great student. She's excellent. I've never had any problems with her. She always does really well in clinical. And so today she came up to me, you know, we're almost at graduation. And she comes up and she has two IV piggybacks to give, 2 different patients. And she went over everything with me. We went over all the 5 rights. She had everything down cold. I've seen her hang IV piggybacks. I've seen her give medications a million times. And so I had another student that was needing me at the time, and I went ahead and okayed her to go give those meds on her own while I went and helped another student. And then the next thing I know, they're calling a code for her patient's room. This is horrible. Oh my gosh, I can't believe she messed up. She gave the wrong medication to the wrong patient.
Has she hung medications on multiple patients?
Yeah, she's done this exact kind of scenario, I feel like tons of times. And I don't know, I talked to her, I got a chance, you know, now the patient, they're in ICU, they're on a ventilator, we don't know what's gonna happen. He was allergic to penicillin and she gave him amoxicillin. So I don't know what's gonna happen. You know, she said that she had it down, and I guess right after I left her side, one of the staff nurses, Karen, do you know her, this unit? She's, you know, she's a good nurse, but she just is really dismissive to the students a lot of times. We've kind of had some troubles in the past with that. And I guess she was in a hurry too or something and told Jenny, hey, go give Mr. Johnson his amoxicillin when it really should have been vancomycin. I guess Jenny tried to question her, but she just, again, dismissed her. Oh, I'm just so frustrated because she knew better. And this nurse, and that's the other thing. This nurse, why was she so pushy and dismissive to the student? And I think the student just felt like, you know, she was the novice and the nurse was the expert, and she did it. Gosh, I don't know what I'm gonna do.
Yeah, have you called the dean?
I called the dean.
Yeah.
You know, and she's so nice, but I know she's frustrated, and I know she's gonna have to, I'm worried. I just finished my doctorate. I've done all this education, and now I could lose my job. It's just so frustrating.
Yeah. Well, let's talk about it when we get back together.
Yeah, all right. Well, thank you. I just needed a minute to vent. Thanks.